My name is Krista Skorupa. I am the site medical director here at Roseville, Health East Roseville, and am a family physician. I've been here for 9 months and have joined Health East recently from the University of Minnesota Physicians. The physician-driven is for real, and I have worked in other health systems here in the metro area and have colleagues in the other health systems, and Health East is unique in that they have physician leadership on every committee at every level, helping make the decisions and formulating the policies and bringing it back to the clinic and making sure that it's okay with their physician colleagues. So it's not so top-down as it is kind of bottom-up decision-making, and I think that that is unique in the metro area, specifically what I'm familiar with. Patient-centered. You're right, you would probably find that in a lot of the other health systems, or certainly they say that, but here, I mean, no one is hired unless that vision is something that we see would easily be adopted. So everybody comes to work with that in mind, and they're here for the patients. They're able to leave what they've got going on at home and come to work to be here for the patient. So it comes across in the quality and how our quality measures at Health East are some of the highest in the state. And a lot of that is because they're not just here to clock in a patient and clock out. It's really to take care of the entire patient. So I do believe that to be unique at the health system, because at the leadership level, it's one of the pillars of what we're encouraged to bring out the best in all of our staff. So physician burnout is something that I think every health system has to be aware of, but I think there's very little of it here at Health East, because there is a real emphasis on work-life balance. I mean, even our executives, a lot of them have families, a lot of them are involved in other community activities, and so they're a role modeling for all of us how it is okay to be and encouraged to be an activist in your community, and not just, again, be here to 8 to 5 see patients. So I'd have to say that's largely why you see everybody so happy, and the ability to retain and have so little turnover at Health East is very impressive too. When you feel supported as a clinician, and like I said, in career development, it's very easy to walk into a patient exam room and feel like you're a better clinician. So most everybody, again, that I work with has gone into medicine because they're passionate about patient care and wanting to help, especially in the primary care field. But it's even easier to do that when you feel supported. When you leave that exam room, you feel like you have the tools to do your job, and the colleagues around you are happy, and the staff around you are here to work and work hard, and it's a work hard, play hard kind of an atmosphere. I mean, everybody doesn't know how to have fun, but when you're here to work hard and serve the patient. So you can read it online about physicians' bios, and you can see that a common theme in why a lot of us have been drawn to Health East is this idea of a partnership. When patients come into our health system, our commitment to you is to care for you as a whole, okay? Not just the chronic disease that's, presented in front of us. It's preventative care, chronic disease management, really delving in again to the social situations and what we can do and have support for you in other aspects of your life that certainly affect your health. And then it's a partnership. We're obviously here to impart the knowledge that we have as clinicians, but that it's trying to understand where you're coming from and what your wishes are, and trying to respect your wishes. So I think and I'm a patient of the health system myself, and it's definitely the idea of a partnership that is very attractive to me.